Most men think their prostate fails simply because they're getting older. That's wrong. Your prostate isn't breaking down because of age. It's breaking down because of something happening inside your body right now, something silent, something most doctors won't tell you about until it's already causing damage. And the worst part? You probably have no idea it's happening. I'm Dr. Natalia Parker, and I'm going to explain this with clarity. Your prostate doesn't get sick from aging. It gets sick from accumulation, from toxic buildup, from chronic inflammation you can't see or feel. And by the time symptoms appear, the damage has already been progressing for months, maybe years. What I'm about to explain will change how you think about your body, because there's a specific process happening in your prostate tissue right now. And if you understand it, you can stop it. If you ignore it, you're heading toward enlarged prostate, recurring infections, sexual dysfunction, or worse. Let me ask you something. When was the last time you thought about what's actually happening inside your prostate? Not just whether it works, but what's building up in there. Because most men never think about this until they're already sitting in a urologist's office with symptoms they should have prevented years ago. Here's what nobody explains properly. Your prostate is a gland. It produces fluid. It sits right below your bladder, wrapped around your urethra, and it's one of the most sensitive organs in your entire body. Every toxin you consume, every infection you ignore, every nutritional deficiency, it all affects your prostate directly. And over time, this damage doesn't just disappear, it accumulates, like internal debris that slowly blocks normal function. When I say your prostate gets dirty, I'm not talking about physical dirt. I'm talking about cellular saturation, oxidized fats, free radicals, abnormal cells that shouldn't be there, inflammatory compounds that turn your prostate tissue into a war zone. And the problem is you don't feel this happening. There's no pain, no alarm, just silent deterioration. So what actually causes this toxic buildup? There are 4 main pathways, and you're probably triggering at least 2 of them without knowing it. First, diet. If you eat a lot of red meat, processed meats, heavy dairy, fried foods, you're creating an inflammatory environment in your body, and that inflammation doesn't stay in your stomach. It circulates. It reaches your prostate. It causes swelling, fat accumulation around the gland, and increases your risk of abnormal growth. On the other hand, a diet rich in natural antioxidants helps clear that accumulated fat and reduce tissue inflammation. Second, environmental toxins. You're surrounded by pesticides, plastics, chemicals in water, air, even your cooking utensils. These enter your body slowly, gradually, and they accumulate. Your prostate, because it's highly vascularized, is one of the organs most affected by these toxins. Many men have elevated levels of cadmium, lead, mercury without ever knowing it, and these metals disrupt normal prostate cell function. Third, sexual inactivity. Not many people talk about this, but regular ejaculation helps empty prostatic fluids. When you go weeks without ejaculating, the prostatic fluid stagnates. Its composition changes. It becomes thicker, more prone to infection, more inflammatory. I'm not suggesting compulsive behavior, but a healthy, conscious sex life actually protects your prostate. Fourth, untreated urinary infections. Many men experience burning during urination, cloudy urine, constant need to use the bathroom, and they ignore it. They think it's nothing, but what they don't know is that a mild infection can escalate and penetrate the prostate, causing chronic prostatitis. And the worst part? Many times this chronic prostatitis doesn't cause fever or pain, just fatigue, pelvic discomfort, urinary dripping, and reduced sexual quality. Now here's where it gets serious. There's a type of damage happening in your prostate that almost never gets diagnosed. Silent inflammation. Low-grade chronic inflammation. You know what that means? It means that even if your test results come back normal, your prostate could be in a constant state of inflammation because of what you eat, your lifestyle, oxidative stress, and poor circulation. And this mild but constant inflammation disrupts glandular function, alters prostatic fluid production, compresses the urethra, and eventually promotes abnormal cell growth. In simpler terms, it's like your prostate is on fire, but you don't feel the flames until it's too late. But wait, before I tell you exactly how to clean this toxic buildup, I need you to understand something crucial. There are early warning signs your body is already giving you. And if you learn to recognize them, you can act before permanent damage occurs. Frequent need to urinate, even at night. Weak or interrupted urinary flow. Feeling like you can't completely empty your bladder. Mild pain in the pelvis or between the testicles and anus. Reduced ejaculatory force or semen volume. Unexplained fatigue and low sexual desire. If you have two or more of these symptoms, your prostate might already be saturated with inflammation and metabolic waste, even if your tests show normal results. Now, here's the critical question. Can your prostate actually be cleaned? Can you reverse this toxic accumulation? The answer is yes. Just like you clean your intestines with fiber, your liver with certain bitter vegetables, or your kidneys with water, you can also clean your prostate through specific foods and nutrients that promote three essential things: deep anti-inflammation, reduction of cellular oxidative stress, improved blood circulation in the prostatic area. And I'm going to tell you right now, there's one food that stands above all others. It's not exotic, it's not expensive, it's not new. In fact, you probably already know it, but you're not using it correctly. And I'm going to reveal exactly what it is, how it works, and what studies back it up. But before that, I need to make sure you understand 4 things you must stop doing immediately if you want to start detoxifying your prostate. First, eliminate processed meats, frequent red meat consumption, and fried foods. These increase arachidonic acid levels, which directly promotes prostatic inflammation. Second, avoid excessive alcohol. Alcohol reduces zinc levels, a key mineral for prostate health, and it also intoxicates your liver, which is your body's main filter. Third, reduce caffeine and energy drinks. These irritate the bladder and in some cases worsen urinary symptoms. Fourth, don't hold your urine. Retaining urine puts pressure on the prostate and promotes infections or prostatic congestion. Comment below right now and tell me, how many times do you wake up at night to use the bathroom? This simple answer can give us a clue about your prostate's current state. Now, let me reveal what this food actually is. The food that not only prevents prostatic damage, but activates a natural cleaning process inside your body. And I'm not saying this from intuition or marketing. I'm saying this from medical and biochemical evidence. This food has the capacity to reduce inflammation, block free radicals, support prostatic detoxification, and protect against benign hyperplasia and even cancer. That food is cooked tomato. Why cooked and not raw? Tomatoes contain a powerful antioxidant called lycopene, which belongs to the carotenoid family. This compound has been extensively studied for its ability to reduce the risk of prostatic diseases, especially benign prostatic hyperplasia and prostate cancer. But here's the key detail. Lycopene is released in much higher quantities when the tomato is cooked, especially if accompanied by a bit of healthy fat like olive oil. That's why in nutritional medicine we talk about cooked tomato with oil as preventive medicine for the prostate. But what does lycopene actually do inside your prostate? Clinical studies have demonstrated that lycopene has several crucial functions for prostatic health. First, it reduces local inflammation. Lycopene modulates the activity of inflammatory cytokines like interleukin-6 and tumor necrosis factor. These substances are responsible for the inflammatory environment that damages prostatic tissue. By reducing their action, lycopene helps calm the internal fire that's wearing down your prostate from the inside. Second, it neutralizes free radicals. The prostate, due to its high level of metabolic activity, produces a large amount of free radicals, molecules that attack DNA and proteins. Lycopene is one of the most potent antioxidants for blocking this oxidative damage, protecting the prostatic cellular structure. Third, it modulates cellular growth. Various studies have shown that lycopene interferes with the uncontrolled growth of prostatic cells, especially in states of hyperplasia or precancerous changes. It acts by promoting apoptosis, programmed cell death of abnormal cells, and favoring the regeneration of healthy cells. Fourth, it improves local circulation. Prostatic health also depends on good blood supply. Lycopene improves endothelial function and reduces the formation of microclots in capillaries, allowing more oxygen-rich blood and nutrients to reach the prostate. Now, this isn't just theory, there's solid research behind this. A meta-analysis published in Cancer Epidemiology, Biomarkers and Prevention reviewed over 20 studies and concluded that high lycopene consumption is associated with a reduction in prostate cancer risk of up to 30%. In another clinical study published in the Journal of Nutrition, men who consumed 30 milligrams of lycopene daily for 3 weeks showed a significant reduction in PSA levels, prostate-specific antigen, which is a key marker of inflammation and prostatic growth. Research from Harvard University confirmed that men who consume more cooked tomato have lower incidence of benign hyperplasia. These data confirm what we already see in clinical practice. Lycopene acts as a shield for the prostate. But here's what most people get wrong. It's not enough to just eat a slice of raw tomato occasionally. To obtain real clinical benefits, the form, frequency, and combination of the food are key. Ideal form: cooked tomato. Preparations like tomato puree, homemade tomato sauce, tomato soup, or roasted, always with healthy oil. Lycopene is fat-soluble, which means it's absorbed better when accompanied by fat. The ideal choice is extra virgin olive oil. Recommended quantity: between 20 and 30 milligrams of lycopene daily. This equals approximately 1 cup of cooked tomato sauce per day, or 4 to 5 medium-sized tomatoes well cooked per week. Frequency: minimum 5 times per week. Clinical studies are based on consistent consumption, not sporadic doses. Who benefits most from lycopene? This food is especially useful for men over 45 with symptoms of prostatic growth, men with family history of prostate cancer, patients with chronic prostatitis or persistent urinary discomfort, those with elevated PSA levels, and people with pro-inflammatory eating habits. But even in young men, lycopene can act preventively, strengthening prostatic cellular structure for the future. Are there contraindications? Cooked tomato is generally safe for most people. However, some important points. Men with severe acid reflux should avoid very spicy preparations. Those with tomato allergy or food histaminosis should consult their doctor first. Avoid industrial sauces rich in sugar, sodium, or additives. Use natural tomato. Now, let me share a brief case from my practice. A 57-year-old patient came in with symptoms of weak urine flow, need to use the bathroom at night, and discomfort during ejaculation. He had slightly elevated PSA and an initial diagnosis of benign prostatic hyperplasia. I prescribed dietary changes, and one of the pillars was incorporating natural tomato sauce cooked with olive oil in his breakfast or dinner 5 times per week. After 3 months, symptoms decreased noticeably. PSA dropped to normal range. We avoided aggressive medication. This shows that the body can respond when you give it what it needs. But knowing what to eat isn't enough. What matters is how you eat it, when you eat it, what you combine it with, and what habits you sustain long-term. So let me give you a practical protocol based on medical evidence to build a protective and regenerative diet for your prostate. What's the main objective of this food strategy? Reduce chronic prostatic inflammation, eliminate accumulated toxins in glandular tissues, prevent abnormal growth of prostatic cells, improve semen quality and sexual function, decrease bothersome urinary symptoms, avoid unnecessary pharmacological treatments. This plan is useful both for men who already have symptoms and for those who want to prevent future prostatic complications. Strategic consumption of lycopene. As we saw, cooked tomato is the best source of lycopene, but consumption must be consistent and in adequate amounts. Recommended dose: 1/2 to 1 cup daily of homemade tomato sauce cooked with olive oil. Ideally, consume it with the main meal of the day, preferably lunch or dinner. Practical ways to incorporate it: natural tomato sauce over brown rice, quinoa, or whole grain pasta. Roasted tomato with oregano and olive oil. Tomato soup with turmeric and black pepper. Tomato puree with steamed vegetables and lean protein. But tomato alone isn't enough. There are foods and nutrients that, when combined with cooked tomato, multiply its antioxidant, anti-inflammatory, and protective effect on the prostate. Zinc, present in pumpkin seeds. Zinc is essential for prostatic function. Its deficiency is associated with benign hyperplasia, prostatitis, and fertility deterioration. Include 1 to 2 tablespoons daily of unsalted pumpkin seeds. You can add them to salads, natural yogurts, or eat them as a snack. Omega-3, present in flaxseed, chia, walnuts, and fatty fish. Omega-3s reduce the low-grade inflammation affecting the prostate and improve circulation. Include 1 tablespoon daily of ground flaxseed or chia. Consume fatty fish like salmon, sardines, or mackerel twice a week. Curcumin, present in turmeric. It's one of the most potent natural anti-inflammatories. It acts directly on the prostaglandin pathways that produce prostatic inflammation. Add turmeric to your meals, soups, or infusions. Always accompany it with black pepper and healthy fat for absorption. Broccoli and cruciferous vegetables, rich in sulforaphane, a phytochemical that favors hepatic detoxification and blocks the proliferation of tumor cells in the prostate. Consume steamed broccoli, cauliflower, cabbage, or kale at least 3 times per week. Now, here are the most common mistakes that destroy these benefits. First, using industrial sauces. Commercial sauces are loaded with added sugars, salt, colorants, and preservatives that inflame the prostate. Solution: prepare your sauce at home with fresh tomatoes, garlic, olive oil, and natural herbs. Second, not using oil or healthy fat. Lycopene is fat-soluble. Without fat, your body doesn't absorb it correctly. Solution: always accompany cooked tomato with a teaspoon of olive oil. Third, cooking at very high heat or for too long. This can destroy part of the lycopene and oxidize the oils. Solution: cook over medium heat and avoid frying. Fourth, eating tomato only occasionally. Sporadic consumption doesn't generate significant changes in prostatic health. Solution: integrate cooked tomato into your diet as a habit, not as an exception. How long does it take to see the effect? The prostatic anti-inflammation process isn't immediate. Generally, 3 to 4 weeks are required to notice improvements in urinary symptoms. 6 to 12 weeks to see decreases in PSA levels in men with hyperplasia. More than 3 months to consolidate long-term protective effects. Consistency is key. Remember, you're not curing a symptom, you're healing tissue. Other habits that complement this cleansing. Diet is essential, but you must accompany it with habits that enhance its effect. Avoid alcohol and tobacco. Both are severe prostatic inflammatories. Maintain regular sexual relations. They help empty accumulated prostatic fluid. Hydrate correctly. 1.5 to 2 liters of water per day improve urinary function. Do moderate physical activity. Walking 30 minutes a day improves perineal circulation. In my practice, I've seen dozens of patients with chronic prostatic inflammation or bothersome urinary symptoms who, by implementing this strategy for 3 months, manage to urinate with greater force and without interruptions, stop waking up at night, recover their sexual desire, and avoid medication or surgery. This demonstrates that the prostate responds when a man acts with awareness and commitment. So here's the final truth. Your prostate doesn't age because of years, it ages because of neglect. And cooked tomato, accompanied by the right nutrients, can be the beginning of its recovery. You don't need miracle formulas or expensive treatments. You need a warm plate cooked with medical knowledge and served with discipline. Final question for those who watched this complete series. Are you willing to incorporate 5 meals with cooked tomato this week? If you're going to start this natural cleansing, if this content actually helps you understand what almost no one explains clearly, subscribe to the channel. Because here we talk about what matters, with evidence, without filters, and with the only goal of protecting your health. Your prostate is silent, but when it screams, it does so with pain, dysfunction, and years of suffering. Don't wait for that to happen. Start today.